What is the pancreas? The pancreas is a glandular organ in the digestive system and endocrine system of vertebrates. The pancreas is an endocrine gland producing several important hormones which circulate in the blood, as well as an exocrine gland secreting pancreatic juices that aid in digestion and absorption of nutrients in the small intestine.
Structure and location in the body. In humans, the pancreas is located in the upper left part of the abdomen behind the stomach. Anatomically, the pancreas can be divided into three sections: the head, body, and tail of the pancreas. The head of the pancreas is connected to the duodenum, which is the first part of the small intestine immediately beyond the stomach. The typical adult pancreas is about 15 centimeters long, but they can vary greatly in size. The exocrine portion of the pancreas uses two main ducts to release its pancreatic juices into the duodenum. These are the main pancreatic duct and the accessory pancreatic duct. The exocrine tissue is composed of clusters of cells called acini, which are arranged in lobules and separated by a thin fibrous barrier. The pancreas also contains tissue with an endocrine role, and these tissue are called pancreatic islets, or also called islets of Langerhans. Endocrine tissue do not require ducts as they release their contents directly into the bloodstream.
Function of the pancreas, endocrine. The function of the pancreas can be divided into two categories: endocrine function and exocrine function. Endocrine refers to a gland that secretes hormones or molecules directly into the blood. The endocrine tissue of the pancreas is made up of approximately 3 million cell clusters called pancreatic islets that secrete glucagon, insulin, somatostatin, pancreatic polypeptides into the blood. This hormone works in concert to regulate blood sugar level. Problems with the endocrine pancreas are associated with diabetes and lead to eye, nerve, and kidney disease.
Functions of the pancreas. Exocrine. Exocrine refers to a gland that secretes molecules through duct openings and onto an epithelium rather than directly into the bloodstream. The exocrine portion of the pancreas is composed of clusters of acini cells that secrete their products into interlobular ducts, which drain into the main pancreatic duct, which drains directly into the duodenum. The products of these exocrine pancreas are bicarbonate salts, which are alkaline and neutralize the gastric acid coming from the stomach; amylase, which breaks down carbohydrates; lipase, which breaks down fats; and two proteolytic enzymes called trypsogen and chymotrypsogen, which break down proteins but are inactive until entering the duodenum. Problems with the exocrine pancreas are associated with an inability to digest food and neutralize stomach acids.
What is pancreatic cancer? Pancreatic cancer arises when the cell of the pancreas begins to multiply out of control and form a mass. These cells have the ability to invade other parts of the body. There are many types of pancreatic cancer, and they can be divided into two main groups: exocrine cancer and endocrine cancer, or neuroendocrine cancer. Both types occur mainly in people over the age of 40 and are slightly more common in men.
Exocrine cancers. Exocrine cancers represent the vast majority, approximately 99%, of all pancreatic cancers. The most common type of exocrine cancers of the pancreas is pancreatic adenocarcinoma, which represents 85% of all pancreatic cancers, and the term pancreatic cancer is sometimes used to refer to only this type. Pancreatic adenocarcinoma originates in the ducts of the pancreas, which are used to secrete pancreatic juices into the duodenum, and approximately 60 to 70% of adenocarcinomas occur in the head of the pancreas. The next most common type of cancer is Acinar cell carcinoma of the pancreas, which arises in the clusters of cells that produce digestive enzymes and represents 5% of pancreatic cancers. Acinar cell carcinomas may cause overproduction of digestive enzymes, which may present as skin rashes and joint pain. The remaining type of exocrine cancers of the pancreas include cystademocarcinoma, pancreoblastoma, adenosquamous carcinoma, singlet ring cell carcinoma, hepatic carcinoma, colloidal carcinoma, and undifferentiated carcinoma.
Endocrine cancers. The small minority of pancreatic cancers that have an endocrine origin are pancreatic neuroendocrine tumors, or PANET for short. Neuroendocrine tumors are a diverse group of benign or malignant tumor that arises from the body's neuroendocrine cell. The malignant type of PANET are all considered to be rare. PANET can be divided into two groups, functioning and non-functioning, which reflects the ability of endocrine tissue to produce and secrete hormones for regulation of blood sugar level. Functioning PANET leads to an overproduction of hormones and can present as constant low blood sugar level. The benefit of this is that it's a form of early detection. Non-functioning PANET do not secrete hormones but avert clinical symptoms only manifest after enough endocrine cells have been affected. By this time, the cancer has usually spread to other parts of the body.
Signs and symptoms. Pancreatic cancer usually does not cause overt clinical symptoms in its early stages. Because of this, the disease is typically not diagnosed until it has spread past the pancreas itself. This is one of the main reasons why pancreatic cancer has the lowest survival rates of any prominent cancer, with 25% of individuals surviving 1 year and only 5% surviving 5 years. The notable exception is functional PANETs, which have a 5-year survival rate of 65%. Common symptoms of pancreatic cancer include pain in the upper abdomen and back, which is the main symptom in 2/3 of patients and is accompanied by jaundice 46% of the time. Jaundice, which is a yellow tint to the white of the eyes or skin, occurring when the cancer is located in the head of the pancreas and thus obstructing the common bile duct. Unexplained weight loss, either from loss of appetite or a loss of exocrine function resulting in poor digestion. Nausea and feelings of fullness can be caused by the tumor pressing on neighboring organs, including the stomach. Foul-smelling, fatty feces and constipation are caused by undigested fats and can be difficult to flush away. Diabetes. At least 50% of people with pancreatic adenocarcinoma have diabetes at the time of diagnosis. As exocrine cancers of the pancreas cause diabetes, recent onset diabetes can be considered an early sign of the disease. Trousseau syndrome and clinical depression are also found in 10 to 20% of people with pancreatic cancer.
Risk factors: age, gender, and ethnicity. Age, as we've learned in class, the risk of developing any kind of cancer increases with age. In pancreatic cancer, most cases occur in people over the age of 65 and is considered uncommon in people under the age of 40. Gender. Pancreatic cancer is slightly more common in men than women. Ethnicity. In the United States, pancreatic cancer is 1.5 times more likely in African Americans, although incidence in Africa are low. Cigarette smoking is the best available avoidable risk factor in pancreatic cancer, approximately doubling the likelihood of developing pancreatic cancer in long-term smokers. The risk declines when individuals quit smoking and can return to baseline after 20 years of abstinence. Obesity increases the risk of contracting pancreatic cancer by 50%. Heredity is associated with 5 to 10% of pancreatic cancer cases. The risk increases if more than one first-degree relative had the disease. Hereditary pancreatitis increases the lifetime risk of pancreatic cancer by 30 to 40% by the age of 70. Chronic pancreatitis, which is a long-standing inflammation of the pancreas, almost triples the risk, and new onset pancreatism may be a symptom of tumor. Diabetes. At least 50% of people with pancreatic adenocarcinomas have diabetes at the time of diagnosis. As exocrine cancer of the pancreas causes diabetes, recent onset diabetes can be considered as early signs of the disease. Alcohol. Excessive alcohol consumption is a major cause of pancreatitis, which in turn predisposes people to pancreatic cancer.
Diagnosis. The symptoms of pancreatic adenocarcinoma usually do not appear until the later stages of the disease and are individual and not distinct of the disease itself. The symptoms mentioned previously are used to diagnose the disease, with unexplained weight loss and nausea being the most common. Tumors in the head of the pancreas usually present as jaundice, pain, loss of appetite, dark urine, a light-colored, foul-smelling, fatty stool. Medical imaging techniques such as, but not limited to, CT scans and endoscopic ultrasounds are used to definitively diagnose the disease and determine whether surgical removal is possible.
Treatment and management. Surgery. In exocrine cancer of the pancreas, the key assessment in terms of treatment and management that needs to be made is whether the tumor can be surgically removed, as this is the only cure for the disease. The ability to perform surgical removal depends on how much the cancer has spread, the location of the tumor, the general health and age of the patient, and the skill level of the surgeon as the pancreas. Unlike other organs, is not encapsulated and can be damaged easily. Surgery with the intention of cure is only possible in 20% of new cases. Chemotherapy. Chemotherapy can be used after surgery to decrease the likelihood of the cancer reappearing, but is only used if the patient is sufficiently fit. In patients where curative surgery is not possible, chemotherapy can be used to extend the life or improve its quality. Radiotherapy. Radiotherapy may be used as an auxiliary treatment for curative surgery. It may also be used to shrink the size of tumor in order to make curative surgery possible. PANET. Treatment for PANET tumors has a number of approaches that may differ from exocrine tumor. Small PANET tumors for less than 1 centimeter in diameter are generally followed by watchful waiting, which may be influenced by the associated risk of surgery to the specific patient, as well as the site of the tumor. Localized tumor or tumor with limited metastasis may be removed surgically and carry less extensive surgical procedure than pancreatic adenocarcinomas. Patients will need to take supplementary insulin if they have non-functional pancreatic islets. Palliative care. Palliative care is medical care that focuses on treatment of symptoms and improvement of quality of life rather than attempting to cure the disease or cause of the symptom. As pancreatic adenocarcinoma is usually diagnosed after it has progressed to an advanced stage, palliative care may be the only valuable treatment protocol. Pain can be managed through opioid or through procedural interventions such as nerve blocking on the celiac pelvis, which alters or destroys the nerves that transmit pain from the abdomen. Celiac pelvis blocking is a safe and effective way to reduce pain without the need of opioid painkillers, which have negative physical and mental side effects.
Staging. The stage of a cancer is a term used to describe its size and how far it has spread within the body. It provides doctors a way to systematically assess how far advanced the cancer is for each individual patient so that the most suitable treatment option may be considered. Pancreatic cancer is usually staged following a CT scan. Staging is based on the TNM classification. This system looks at three important disease parameters: tumor T, lymph nodes N, metastasis M, which medical research has shown to be reproducible indicators of cancer disease progression. The information from each of the combined are given an overall stage number, which may be further divided alphabetically. Pathohistology. This is a slide of an adenocarcinoma. As you can see at the top left-hand corner, you will see normal pancreatic cells showing glandular structures and normal nuclei. At the bottom right corner, you will see inflammatory cells. In the center, you will see fibrous tissue. In the top right corner, you will see glands of infiltrating adenocarcinoma with big, dark, pleomorphic, hyperchromatic nuclei. These cells do not conform to normal lobular growth. As well, at the bottom, you can see veins with invading nuclei.
In conclusion, pancreatic cancer is the fourth leading cause of death among cancers in North America. 41,000 people in the United States will die from the disease this year. For the last 40 years, the 5-year survival rate has remained in the single digits. Currently, research dollars dedicated to pancreatic cancer accounts for 2% of NCL spent, while the other top 5 cancer killers receive 3 to 6 times as much funding. This needs to change if the 5-year survival rates for pancreatic cancer are going to improve.
Thank you so much.
Thank you so much.